It's our health service and it's not for sale.
I'm here to defend the National Health Service. It's ours and therefore it's not for sale.
One of the most important things everyone in this country believes in, and they're aiming to privatise, and I'm totally against that.
We're from Tower Hamlets Hands Off Our Public Services, also known as Tower Hamlets Hoots. We're one of many anti-cuts groups across London, and we're here because we do not want to see the privatisation of the National Health Service or any public services.
If this bill goes through, it'll be the privatisation and fragmentation of the NHS. There's a lot of GPs, particularly in Hackney, that are really worried about the bill.
I don't like what the government are doing. I think it's absolutely so dangerous. Well, I came partly as an individual and partly because I'm a member of the Southwark Pensioners Action Group.
I work in Tower Hamlets, and there they have a GP practice that was given over to a private consortium, which ended up failing and having to hand back the practice and be saved by a group of GPs.
We say health comes first, the National Health Service comes first, decent jobs and conditions comes first. That's why we're here to say no to the NHS bill, no to the reorganisation, yes to the most civilised thing this country possesses, that is the principle of healthcare free at the point of use for everybody. Stand for that. Thank you.
Who's NHS? NHS! Who's NHS? NHS!
We're here because we're fighting against all of the government cuts, and this one particularly. There's cuts at all hospitals, and we're, as student nurses, that means that when we qualify, we're not going to have, or it's going to be hard to find a job, and when we do find a job, it'll be understaffed and very stressful. So yeah, we are directly concerned about ourselves. Also for patient care, it's just not going to be possible to provide the patient care that we'd like.
I'm actually quite scared. I was here this morning. In this hospital, I had to come up and have my liver scanned because something was going wrong. So, I think we're all very dependent on the health service, whether we're healthy or not healthy.